Yeah, hi. Hi, good afternoon, everyone. Yeah, today my topic is on Ganoderma, on complement treatment to hypertension. Yeah, hypertension is also so-called high blood pressure. Yeah, next. Yeah, first we start with a disclaimer. So all this information that contains all the slides are intended for general health information and educational purposes only, and are not intended to be used as a substitute for professional medical advice, treatment, okay? So just to take, yeah, next. Okay, first we look at the circulatory system. The circulatory system is made up of your heart, blood, and blood vessel. So this blood vessel actually work with your heart and lungs to continuously circulate the blood throughout your body. And our heart actually pump 100,000 times per day. So the blood vessel include arteries, veins, and capillaries. So arteries are the one that take blood away from the heart, and veins actually carry blood to the heart. So capillary, as for capillary, they are actually very small blood vessel, and they have very thin walls. So capillary are where the oxygen and nutrients are exchanged for carbon dioxide and waste. So main function of this circulatory system is to provide oxygen and nutrient to cell and take away the waste, so as to keep the body in a proper balanced state. Yeah. So many conditions can actually affect the health of your circulatory system. Here are some of the diseases. Yeah. First, arteriosclerosis. So over time, the blood vessel started to have build-up of fats, cholesterol, or other substance that actually build up in the artery wall, okay, and causes the vessel to actually stiffen, and the internal space will be very narrow. So this process actually gradually restrict the blood flow to your organ and tissue. So once this vessel wall become thickening, blood flow through the narrow passage would lead to another condition, which is hypertension. So hypertension, also known as high blood pressure, yeah, and is the high force of blood uh, pressing against the artery wall over time. Yeah. So when you talk about high blood pressure, this is the force that we are referring to. And the next one, next condition, this will actually lead to another condition called heart disease. So heart disease is that the blood vessel that supply the oxygen to the heart become narrow and stiffen. Yeah. So other diseases such as deep vein thrombosis, a blood clot in the leg, actually can lead to life-threatening, so-called the pulmonary embolism. So these are the condition that actually lead tends to affect veins in the lower body. Yeah. So in general, the above conditions are at a higher risk related to stroke, heart attack, and sometimes can be life-threatening. Yeah. Next. Yeah, hypertension or elevated blood pressure is a serious medical condition that significantly increase the risk of heart, brain, and kidney and other diseases. So, example, the risk actually include heart attack, stroke, and kidney damage. Now we look at some numbers. Yeah, globally, there are estimated 1.13 million people have hypertension. So in 2015, 25% in men and 1 in 5 women had hypertension. Yeah, in Singapore, for the age group of 30 to 69-year-old, okay, 1 in 4%, 25% also having hypertension. Yeah, so this one include all genders. As for age 60 and above, 60 to 69-year-old, this group, more than about 50% having more than 50% having this hypertension. Yeah. Yeah, next. Okay, so what is blood pressure? So blood pressure is actually pressure extended by the blood from the heart against the main artery. It is the pressure against the internal wall of artery. So it is recommended to actually measure 3 times, okay, each day. Systolic greater than 140 millimeter mercury, and diastolic is greater than 90. So these two numbers, when it's greater, it means it's a high blood pressure. So systolic, okay, when you measure the in a device for the blood pressure measurement device, there are two numbers. One is a systolic and one is diastolic. So systolic is the top number. So systolic is the pressure that reading when the heart beats, okay? And as for the diastolic, it's taken when the heart is at rest between the beats. Yeah. So these are the two different numbers. Yeah. So 4 factors that actually affect the blood pressure. First is the heart. It depends how fast it beats. So it acts like a pump. So when we are under, the next is the when we are under the emotional stress, blood pressure will increase. Yeah, as the body raises the heartbeat. So what it does is stimulate vessel contraction to increase the blood pressure during the fight or flight mode. Yeah. The next is the blood viscosity. So blood viscosity is how thick the blood is. So for example, in hyperlipidemia, this is excess cholesterol and triglyceride in blood. So this actually would lead to an increased blood viscosity, meaning it's thick. Yeah, the blood is thick. So thick blood can actually increase the risk of blood clot and thrombosis, which can be life-threatening. Yeah. So your heart is a muscle. Heart actually increase its strength of its contraction. Yeah. So elasticity of blood vessel is also another factor. In the case of arteriosclerosis, there are excess lipid and platelets adhere to the surface wall. So all this lead to a narrow arteries, and it leads to elastic fatigue, fibrillation. This will actually lead to a heart to increase its force of contraction. Yeah. So for example, when we exercise, we need more energy and oxygen. In order to allow for more blood to actually flow to those areas in the body that need the additional blood, we will need the blood vessel to be elastic, like a rubber tube that can expand when the heart pump at a higher pressure. Yeah. So that it actually can maintain and regulate at a normal blood pressure. Okay, if the elasticity is there, then they can actually maintain accordingly. So over the year, when we age, yeah, our heart and blood vessel would actually demonstrate the sign of wear and aging. So after age 45 years old, maintenance of blood fluidity and vascular elasticity is important for prevention and control of this hypertension. Yeah. Then yeah. Okay. So how does the body maintain normal blood pressure? Yeah. The heart actually can speed up and contract more frequently, meaning it actually can beat how fast or how slow. So increase the blood, the flow of blood into the arteries and increase the blood pressure. So heart can actually beat faster to increase the blood pressure so as to increase the blood flow. Yeah. Second, the arterial veins can expand and narrow. So when the arterial vein expand, more blood can be stored and less blood returns for the pumping. So because of this, it can actually regulate and maintain the lower blood pressure. Yeah. So next is the gland. adrenal gland actually regulate the blood pressure. So what it does is actually produce adrenaline. It's a hormone that actually increase the blood pressure. So this adrenaline is a fight and flight hormone. It is acute an acute stress response. So it makes and released by your adrenal gland, which are this adrenal gland is actually located at the on top of the each kidney, and is actually a head shaped gland. Yeah. So when we are under stress or angry, your heart will actually beat faster. That lead to increase of blood pressure. Yeah. So actually this gland will actually release the hormone to actually increase the blood pressure. Yeah. So this is a fight and flight response. It's our body natural response to stress situation. Yeah. Next. Okay. Another organ also play a very important role in regulating the blood pressure. It's a kidney. So it provides a hormonal mechanism called renin-angiotensin system. In short, we call RAS. So when in low blood pressure, kidney actually make renin and convert the angiotensin, which is actually made by liver, okay, to another hormone called angiotensin 1. So there is another enzyme called angiotensin converting enzyme. So this can be found in the lung. So it actually metabolizes angiotensin 1 into angiotensin 2. Yeah. So so this angiotensin 2 will actually cause blood vessel to actually constrict, and the blood pressure will then increase. So just now low blood pressure, now going through this process, blood pressure become higher. Yeah. So the kidney also can, yeah. So the kidney also can change the amount of urine that is produced. Yeah. As we know, kidney is doing the filtering. Yeah. When kidney make less urine, especially when it is not functioning well, what happens is that all the excess water stay in the bloodstream, in the body. So the amount of volume of blood that actually fill the arteries and vein increase. And as a result, the blood pressure also increase. Yeah. Yeah, now we look at the sign and symptom and complication and also the causes. Yeah, for the, as we know, that high blood pressure is often called the silent killer. And because most people who have it actually don't have any symptom, and that silent can be deadly. Yeah. So it's symptomless unless at hypertensive crisis. For example, when you do measurement on the blood pressure, the systolic of higher, with the higher numbers of 180, or diastolic of 110 or even higher. So these two numbers are very critical to look at. Yeah. So you may at that point of time, you may actually experience severe headache and anxiety and shortness of breath and probably nosebleed. Yeah. Then next. As for complication, yeah, higher chance of getting heart attack or stroke. Okay. So risk of death from ischemic heart disease and stroke. So ischemic heart disease is the heart problem that caused by narrow heart arteries. Yeah, actually the heart is actually wrapped around, also have all the arteries that wrap around, and it require all the sufficient blood flow to the heart muscle so that it actually can do the pumping effect. Yeah. So when arteries are narrow, lesser blood and oxygen can reach the heart muscle. Yeah. Also take note that there is an increased risk, okay, with every 20 millimeter of mercury, which means the measurement on the systolic or diastolic, increase in systolic, or 10 millimeter mercury in diastolic pressure. So these two numbers, if there's any increase of that number, so it's higher, the risk is increased for the, yeah. So next complication will be the affect the blood vessel in the kidney and eyes. So over time, uncontrolled high blood pressure can cause arteries around the kidneys to actually narrow, weaken, or harden. Yeah. These damaged arteries are not able to deliver enough blood to the kidney tissue. So damaged kidney arteries don't filter blood well. Yeah. As similarly to the eyes, vision will be affected because of the pressure in the artery and so-called the caterpillar. So next is the trouble with memory or understanding. Yeah. So this also affect the brain. Yeah. Because the brain at all time must have a certain amount of blood flow to work normally. Yeah. So most of the causes are unknown, but it could be due to one of the following: heredity, yeah, hormonal imbalance, endocrine disequilibrium, and diseases or medication. So kidney disease, diabetic, and a narrow of blood vessel, or can even because of diet, obesity. So this excessive intake of salt. Yeah. So next. Okay, now we look at the test and diagnosis. So for blood pressure measurement, just now we mentioned about the blood pressure measurement device. There are two numbers: a top number systolic, and a bottom number diastolic. Yeah. So the systolic is the pressure actually in the artery when the heart beats. And the second number just now we mentioned that is that measure the pressure in your artery when the heart rests between beats. So for normal pressure, the systolic is supposed to be 120, diastolic is less than 80. As for pre-hypertension, it's around 130 to 139 for systolic, and 80 to 89 for the second number, diastolic. Yeah. So I go on hypertension. So hypertension in the systolic, the top number is actually greater than 140. And the second lower number, the bottom number, diastolic, is greater than 90. So people over the age of 60, systolic, okay, is supposed to be around less than or equal 150. Yeah. And the diastolic is less than or equal 90. And for the measurement is recommended to take measurement 3 times per day. Yeah, the first measurement in the morning before eating or taking any medication. Yeah. The second is in the evening. Then also it is recommended to take 2 or 3 reading each time to make sure accurate result. Yep. Now you look at the treatment. Yeah, for treatment of high blood pressure, we have oral medication. Yeah. So here we have 4. The first one is a ACE inhibitor. So what it does is actually block the action of, just now we mentioned about angiotensin converting enzyme. So with that, it actually relaxes the blood vessel. So when blood vessel being relaxed, actually decrease the blood volume and also decrease oxygen demand from the heart. So this will have a possible side effect, means the renal complication. Renal means the kidney will have complication. Yeah, later we'll talk about them in the next slide. Next is the beta blocker, another oral medication. So this is actually to block the effect of adrenaline. Yeah. So this adrenaline is a hormone that created when our body respond to certain sudden situation like stress or angry. So what it does is actually slow down the heartbeat and reduce the force of heart pumping. Yeah. So the possible side effect could be complication for the side effect actually is mainly complication for the asthmatic patient and COPD patient. Yeah. Next is related to calcium, as it actually calcium causes the heart and artery to actually squeeze, okay, more strongly. Okay. So we have calcium channel blocker. So this is another oral medication to actually block the entry of calcium. And this calcium, to block this calcium is actually reduce the electrical conduction within the heart, so that it actually decrease the force of contraction of the muscle, the heart muscle, thus actually dilate the arteries. So the whole idea is to limit, for this calcium channel blocker, the whole idea is to limit how your body use the calcium. So by slowing down how your cell use your calcium, so this medication can actually lower your blood pressure, prevent heart rhythm problem. Yeah. And it also help in open up the blood vessel, so meaning allow more blood to actually flow through. But the possible side effect will be later we will refer to the next slide for the ACE side effect. Next is a sodium, okay? Because sodium pull water into your bloodstream. But if there is too much sodium, you're taking too much sodium, too much salt, it actually pull in too much water. So we have this diuretic treatment. So diuretic treatment is actually eliminate the sodium and water by to filter out by the kidney. Yeah. So if the salt is, if you have too much water actually in the body, they're also in the bloodstream. So you also create a high blood pressure situation. So what this is actually reduce the extra fluid build up in the blood vessel. And the possible side effect will be low sodium. Low sodium, yeah. So later we'll talk about that. Yeah. Yes. Next. Yeah. So now we look at the side effect of all. Just now we mentioned about all those medication. First, we look at the side effect for ACE inhibitor. So headache, dizziness, fatigue, nausea, and persistent dry cough. So this persistent dry is an accumulation of kidneys in the lung. So about 5 to 35% of patients have this problem. So kidneys are protein. Okay, they are protein in the blood. They actually cause inflammation and also affect blood pressure. Yeah. So the next is the side effect. Next side effect for ACE inhibitor is a renal complication, which is referring to kidney. Yeah, you're affecting the kidney. So and hypotension for patient with hypertension. Okay, plus type 2 diabetes. Okay, so this will affect those patients with hypertension with plus type 2 diabetes. Hypotension, just now I mentioned about the complication for this group of patient is that they have hypotension. So hypo and hyper is different. So hypotension is also known as low, it's the other way around. It's actually known as low blood pressure. So it's a blood pressure, okay, when you do measurement, it's under the systolic and diastolic. Number is 90/60, yeah, millimeter of mercury. So symptom for this hypotension is low blood pressure is it will be dizziness, fatigue, and lightheadedness, shortness of breath, and sometimes can be fainting. Yeah, yeah. So another side effect is renal impairment when taking together with renin inhibitor. So renal impairment means that kidney is not able to function well and not able to perform its job, such as removing removing the extra fluid from the body. Yeah. Next, we look at the side effect of beta blocker. So this side effect will be the sleep disturbance, okay, and you have vivid dreams and nightmare. So actually this side effect, actually in fact, for this beta blocker, what it does is actually suppress the nighttime melatonin secretion. So this melatonin is also a hormone. So it affects your sleep because this melatonin hormone is involved in to regulate your sleep, yeah, your sleep regulation, yeah. So the next side effect is it affect the asthma patient because of the concern that this beta blocker medication may actually trigger several asthma attack. Yeah, because asthma when it's attacked, they used to have a narrow airway that cause them difficult to breathe. So as for the next is for the COPD patient. So the side effect for them would be the lung function may actually drop, okay, to drop about 13.5%. COPD is a chronic obstructive pulmonary disorder. So when you look at the term pulmonary, it's actually referring to the lung. So this is a group of diseases that actually cause airflow blockage and breathing related problem. Yeah. Next, we look at the side effect of a calcium channel blocker. So the side effect will be headache, dizziness, and or the irregular heartbeat, fluids build up, and constipation. Yeah, so because due to reduced gut motility, yeah, and facial redness, you could have a gingival overgrowth. So gingival overgrowth is actually a condition that refers to an overgrowth of your gum. Yeah. So all this happen because of the expand blood vessel. Yeah. After taking this calcium channel, you actually expand the blood vessel to actually give the blood more room to flow freely. Yeah. So last one would be the side effect. Okay, for the let me see. For the diuretic, yeah. For the diuretic, yeah, would be have a very low sodium. So sodium, in fact, is an electrolyte that our body needs. It actually helps to regulate the amount of water that is in and around our cell. Yeah. So if it's low sodium, sometimes it's just like dehydration, or during diarrhea time, doctor actually give us some of the medication to actually make sure water is not lost, and also enough so-called electrolyte, yeah, during the time. Next. Okay, now we look at how to prevent. Yeah. So how to prevent high blood pressure? In fact, it's a lifestyle choice to make. You can have a balanced diet. Yeah. Take more fruit and vegetable, and limit your intake of excessive calorie. Limit your intake of salt. Okay. So maintain normal body weight. Okay. So your BMI should be less than 25. So BMI, I guess you all know how to calculate the weight divided by height, and then further divide by height again. Then you get your numbers. So next is to be physically active, do exercise regularly. So recommended 3 times a week. Yeah, and maintain healthy lifestyle. So that include reduce smoking. If you are a smoker, it's good to stop smoking. And if you are a drinker, maybe you can stop or reduce the alcohol intake. And also stress management is also very important. Yeah, and have sufficient rest. Yeah. So next will be TCM. So TCM actually in TCM perspective actually referring to eat more black food, yeah, for related to kidney, yeah. Next. Okay, now we look at Ganoderma and Lingzi. And Ganoderma, also known as Lingzi, is a very special type of mushroom that has the healing property. It has been recognized as a medicinal mushroom for over more than 2,000 years. And its powerful effect have been documented in the two oldest medical books in ancient China, 神农本草经 and 本草纲目. So in the last 50 years of modern scientific research in Lingzi, we can find many evidence-based reports and research published. Yeah, if you do a Google search in the keyword Lingzi or Ganoderma and diseases, you can easily get more than 1,000 results showing the research paper published. And almost all the report can be found in the PubMed website, which is the US National Library of Medicine. Next. So when it comes to selecting so-called Lingzi product, you will be spoiled for choice in the market. So why would you choose Chuangho? Yeah, first, Chuangho is one of the world leaders in producing top quality Lingzi, and their main core business is in researching, producing, and marketing Lingzi. And the company has been in the business for 32 years, specialized in producing top-graded Lingzi product. And the head office is in Taiwan and named as Double Crane. In the Southeast Asia region, it's named as Chuangho. And the company owns their in-house R&D, yeah, Lingzi farm, as well as their distribution network. So through many years of research effort with its patented extraction process, all Lingzi products are extracted with the two unique components, terpenoid and micromolecule polysaccharide content. And all the products have been scientifically certified with various endorsements, TQF, HALA, certified, as well as ISO. Yeah. Now we look at the benefit, the function and the benefit of so-called Lingzi. Yeah, first is to they do regulate immune system. They actually stimulate activity of immune system and macrophage engraft and digest thrombi in blood that is ready to be metabolized. So it actually activates the macrophage for clearing dead cell and thrombus in the blood. So thrombus is a condition commonly known as blood clot that actually form inside one of your vein or arteries. Yeah. So next is improve blood circulation. So remove blood fat such as cholesterol and triglyceride, and thereby increase the vascular elasticity. Yeah, so lower blood pressure. That will actually lead to lower blood pressure. Next. Yeah, so another benefit would be enhanced liver function. So this is very important because it actually, especially in the detoxification, so that liver can actually function properly and effectively in removing the toxin from the body. So this will also help to protect another detoxification organ, which is kidney. Yeah. So another function will be remove free radical and antioxidant. So this is one of the benefits. Yeah. So free radical need to be removed because it can cause damage to the cell. So taking Ganoderma can actually protect and prolong the cell life. Example, blood vessel cell and enhance the cell renewal. Yeah. Yeah. Okay, now we look at the research on this Ganoderma to complement the so-called hypertension treatment. So in terms of the research, there are many studies from different countries Yeah, they have shown a good result. Yeah, so the first one is the animal testing actually focus on lower cholesterol, triglyceride, and blood pressure. So this is a study done from Japan. The second one is a clinical research on lower hypertension. It's also from Japan, one of the university. And the third one is a study on ACE inhibition. Yeah, so also from Japan. Yeah, so they all shown a very good result. Yeah, later I'll do a summary on this. Yeah, next slide, please. Yeah, the fourth one is a clinical research on lower platelet aggregation and weight and size of the thrombi. So the thrombi, just like I mentioned about, is a blood clot. Yeah, referring to a blood clot. So the key takeaway from all this research is that the Linzer effect on hypertension, in particular on these four areas: lower, hypertension directly, lower cholesterol and triglyceride, and inhibit the ACE. Yeah, and the last one will be a low platelet aggregation and thrombi related to blood clot. Yep. Next, we look at the so-called the dosage. Yeah, the recommended dosage. Okay, we have different dosage for different stage. So for prevention, we recommended to take 4 to 8 capsules of YK Ganoderma, Linzer. And for therapeutic pre-illness level, our recommendation is 12 capsules of YK Ganoderma and above. And for autoimmune related, we recommended 20 capsules of YK Ganoderma and above. So autoimmune is a disease that when the body's natural defense system can't tell the difference between your own cell and foreign cell. So causing the body to mistakenly, they will attack your normal cell. Okay. So for therapeutic mega dose, so that would be 30 capsules of YK Ganoderma and above. Yeah, involve many complications. So some people may have reaction when first time taking the Linzer, so-called the Ganoderma. We call this a vertigo reaction, and it is a temporary and short term. So slight increase in this case for blood pressure, there you get maybe slight increase in blood pressure, okay, and or heaviness in the head, okay. So this may last 1 or 2 weeks. It depends on individual health condition. Yep. Okay, now we look at other stronghold product. We can actually include other stronghold product, okay, as our daily supplement. Yeah, as first one we look at is a YK pollen. So what it does is to regulate our nutritional imbalance, help in weight loss, increase stamina, and remove fatigue. Okay, so the next one is a Jaho fiber. It reduces cholesterol and help to reduce cholesterol and triglyceride. Third one is a Jaho instant soya protein powder. So this soya protein is easily absorbed and it helps to reduce excessive fat in the blood vessel and the liver. And next we have something for the eye, YKI plus. So this is the one that is the one with the powerful antioxidant and it actually used for the organ with the blood that needed for the so-called for organ with the blood capillary. So this one help on improve your eye condition. The last one is a CEO coffee. So actually CEO coffee actually added with Linzer, it actually with the coffee, it actually can control your body weight and provide diuretic benefit. Yep. Yeah. Now we look at the testimonial. So this is the testimonial from Taiwan. It's about the genetic hypertension. So Mr. Chang HL, age 54, back in 2014. Okay, his blood pressure always at the high side, in the range of 140 to 150 millimeter of mercury since young. Yeah, so since young he had this problem, and always had aching shoulder and flushed face and heart palpitation. And all these symptoms appear to be the inherited diseases that actually causing this condition. Why? Because other family members, okay, also have high blood pressure. His grandfather had first stroke at the age of 40 plus, yeah, also at a young age, due to high blood pressure, and had a second stroke after 10 years later. And his grandfather lost his vision. And Mr. Chang saw the quality of life affected at an old age for his grandfather. So his father, okay, now his father also have high blood pressure, about 150 mmHg at young teenage age. At that time, also had a nose cancer before. So his father started to take Lingzi for prevention after the cancer treatment. Yeah, his father started to take Lingzi for prevention of his cancer. But after taking Lingzi for 2 years, his blood pressure actually went back to normal without his notice. Only when doctor go for medical checkup, doctor stopped his blood pressure medication, because his blood pressure, if he didn't stop the medication, his blood pressure would be too low if he continue to take the high blood pressure medication. Yeah. So for the younger Mr. Chang, he started the Lingzi at the age of 34. Okay. Took Lingzi, okay, from initial stage of 8 Lingzi and 16 B pollen, and he actually progressively increased to 20 and 40 B pollen. Initially, his blood pressure had been controlled at around 120 mmHg, together with the medication. And at first, he had a vertical reaction. His blood pressure actually rise to 180, and he had giddiness, diarrhea, and aching shoulder. Continued to have aching shoulder, etc. And he continued to take, yeah, and all the reaction disappeared gradually after 3 months. And the blood pressure actually also went back to dropped back to normal. So after a while, he's able to maintain normal blood pressure without the high blood pressure medication. So after a while, doctor stopped his medication totally. So for maintenance, he continued the high concentration type of Lingzi daily. Yeah. So Lingzi is quite effective in controlling the high blood pressure. Actually helped him a lot. So next. Yeah. So next we have the other 3 so-called testimonial. So also from Taiwan. So the second one is, the first one just now we mentioned already. So the second one is Madam Jiang. So at a middle age, this one is Mr. Jiang. So at middle age, he have also have high blood pressure at 160, at quite high, and taking 10 year of Western medication, and 6 to 7 daily dosage is about 6 to 7 picture of YK Lingzi, and don't have any reaction. And blood pressure actually went back to normal. For him, it's actually went back to normal less than 3 months, and also no need to actually consume any Western medication. So his is quite unique. He is only taking for 3 months, but he actually continued to take Lingzi for maintenance. Yeah. So the third testimonial is Madam Liao. So Madam Liao also had blood pressure, okay, at a high of 200, and the diastolic is 100, so it's quite high. She got a post-brain concussion. Why post-brain? Because she got an accident. So it got an accident, and then she got the injury of the brain. Yeah. So so her daily dosage is 9 YK 0 and later she actually maintained at 2 to 9 capsule per day. And the reaction, the so-called the reaction she had is a stomach ache, diarrhea, and headache. So after 1 year, she continued to take the so-called the 灵芝, even though she got the reaction. But after 1 year, her whole body feel different because it feel very light and also able to eat and sleep much better. Initially consume medicine, also consume because she had been consuming Western medication for a very long time, okay, about 10 years, yeah. So and the 灵芝 actually she had to take 灵芝 to actually control the blood pressure. Then slowly she realized that her Western medication had actually start to reduce. Okay, now the blood pressure all back to normal range. Yeah, so her actually taking 灵芝 effectively after 1 year all went back to normal. So the last one is the so the last testimonial is about the same. Yeah, high blood pressure, taking 灵芝, after that got reaction, followed by the control. But this one is different because the systolic, her condition is being controlled at the so-called the blood pressure being controlled. And she got other illnesses that also help. Yeah. Yes. Yeah. Next. So, yeah, in conclusion, yeah, as hypertension is a silent killer, what we can do is to lower our risk, or we prevent it by changing our lifestyle and healthy diet. So it's never too late to actually make healthy lifestyle change, such as quitting smoking, eating healthy food, and getting more exercise. So the main way to protect yourself against hypertension and its complication. Yeah. So hypertension is not so scary, but the scary thing is this complication. So the complication come in with the risk of heart attack and stroke. Yeah. So medication, Western medication, the medication only addresses the symptom and not the root cause. Yeah. So Stronghold has a series of so-called safe and effective health product, Ganoderma, to actually assist you on this recovery journey, as you can see in the testimonial and the research paper. Yeah. With that, I end my presentation. Thank you.